Anatomic lung alterations are a response to injury. The pulmonary capillaries are engorged, and the permeability of the alveolar capillary membranes increases. Then the interstitial and the intra-alveolar swells and hemorrhages occurs, which causes atelectasis and a decrease in surfactant, so the lungs become stiff. The walls become lined with thick, rippled hyaline membrane, and if the acute respiratory distress syndrome lungs are seen, it is usually described as red, beefy, liver-like. Ards is a restrictive disorder. Ards develop within 6 to 72 hours of event and worsen rapidly. Patients may present with dyspnea, cyanosis, bilateral crackles, increase in respiratory rate and heart rate, diaphoresis, increase in accessory muscle usages. They may have a cough, some chest pain, and high oxygen content is required because of the severe hypoxemia that is associated with ARDS. ARDS is diagnosed by ruling out all other possible causes that is associated with respiratory failure and bilateral alveolar infiltrates. General management of ARDS is to give oxygen, to treat the hypoxemia, to decrease the work of breathing, decrease the workload of the heart, and give some PEEP for atelectasis, and mechanical ventilations is used to provide this support of gas exchange. Some patient's bedside assessment chest findings will be a dull percussion note, bronchial breath sounds, and crackles may be heard in the lungs. The FVC will be decreased. The FEV1, FVC ratio will be normal or increased. The FEF 200 to 1200 will be normal or decreased. The peak expiratory flow rate will be normal or decreased. The tidal volume will be normal or decreased. The IRV will be decreased. The ERV will be increased. The RV will be decreased. The VC will be decreased. IC will be decreased. The FRC will be decreased. The TLC will be decreased as well. And patients that have mild to moderate acute respiratory distress syndrome, the pH will be increased. The PaCO2 will be decreased. The bicarb will be decreased. The PA2 decreased as well. In severe acute respiratory distress syndrome, the patient will have a decrease in the pH, an increase in the PaCO2, increase in the bicarb, and a decrease in the PaO2. Some chest x-ray findings will be an increase in opacity diffused throughout the lungs because of the bilateral alveolar infiltrates that develop in the ards. Will have an increase in radial density, increased in lung density, x-ray penetration that will reveal the increase in the opacity. And then in severe ARDS, the denser the lungs become, it will show whiter on the the chest x-ray, and then that is called the ground glass appearance.